taking our questions today again. I'm seeing a lot of people in the live feed online. They're asking about rent. You addressed what mortgage holders can do and how they can get some relief. Is there anything that your administration can do about rent, or is that kind of out of your control?
Clark, do you want to handle the rent issue? Welcome our Chief of Staff, Clark Mercer, to the podium. Thank you, Clark.
Yes, well, let me follow up first on the homelessness displacement issue. Obviously, you cannot stay at home if you do not have a home, so I wanted to cover that topic, and then I'll move into the rent. The governor announced that we will help up to 1,500 Virginians who are homeless find shelter during these trying times. And we put the word out to the private sector, our hotels, to see if they would be willing to accept individuals displaced during this time. And in the last 24 hours, I'm very happy to report that we have over 500 hotels throughout the Commonwealth that have over 37,000 rooms available who are willing to assist the Commonwealth. And I wanted to specifically thank our Secretary of Commerce's team, our Department of Housing and Community Development, the Virginia Restaurant, Lodging, and Travel Association, and our Asian American Hotel Owners Association. As for rent, there's a variety of tools that we have availed ourselves of. Obviously, the Supreme Court has suspended court proceedings, so no one will be evicted during this crisis. Our Virginia Housing and Development Authority is the financing arm for many, the majority of our multi-family tenant and apartment buildings throughout the Commonwealth, and they are using all the tools that they have at their disposal to keep individuals from being evicted during this crisis, and they're getting cooperation from all those folks who do business with the Virginia Housing and Development Association. So there are many efforts through the courts and also through the lenders and banks to make sure that folks have a roof over their head during this crisis.
About wearing cloth masks in public, and then the legality behind that too, because I mean technically face coverings are illegal in the Commonwealth. So what's your guidance on all of that? Yes,
the question is, what about wearing cloth coverings of your face when you're out of your home, and the enforcement, because as you said, Henry, that it is unlawful to cover your face in public. First of all, let me address the second part of that. We know that during times such as these, that people are going to need to protect themselves, whether they have symptoms or not, and so no law enforcement will be bothering anybody because they have a covering on their face. I can assure you of that. As far as the need for that, I want to back up just a second and address the PPE situation. We are still asking anybody that can volunteer PPE to do so. We are working with vendors, not only in Virginia, but around the world to provide PPE. So we want to make sure that the masks, the N95s are available for those that really need them, and those are our first responders, our healthcare providers, individuals working at our nursing facilities, nursing care facilities, et cetera. But if someone has a scarf or another means of covering their face, we know that this virus is transmitted by droplets, whether we're coughing, sneezing, even now breathing. Some of our epidemiologists have told us so. So I certainly wouldn't discourage anybody if they're out of their house for an essential reason, especially if they're around other individuals, to cover their face. I think it not only would protect them, would protect others around them. So I would encourage that to happen.
Roger Watson with the Farm Bill Head.
Thank you, Governor. Continuing on the PPE issue, in Wednesday's press conference, it was assumed that shortage would be solved before the hospital expansion took place. The fact that you only got a fraction of what you requested from the national stockpile, does that affect how the expansion, how quickly that can happen?
Yes, thank you for the question. The question was about PPE. What's in the pipeline? Will we have enough when we see the surge? Dr. Carey, I'm going to allow you to answer that. Thank you.
Thank you, Governor. We are committed to finding every amount of PPE, scouring not just Virginia and the U.S., but internationally. So we are committed to help our health systems, our providers, our first responders, our social service workers who need to go into the home to get them the PPE they need. We are always planning for that next surge that we have to make sure that's there. So even as we plan for alternative treatment sites and how we can better assist our health systems as they do their surge, we have to make sure that we have all of those elements, that we have the staff, that we have the space, that we have the supplies, as well as the systems to provide that care. So we realize that supplies remain an issue, but we are committed to making sure that when those supplies are available, that staffing and space are no longer a constraint. So we are moving forward on all those fronts because we just have to make sure that we do everything we can to be prepared.
Yeah, also on the PPE issue, based on the FEMA data released yesterday, it appeared that states like Maryland and DC were ordering ventilators earlier than Virginia was within their first 2 orders. And I was wondering if there was a reason Virginia didn't do that. And then on PPE specifically, could you talk more about the state suppliers outside their strategic national stockpile and whether those orders are coming in consistently or if they're sort of filled piecemeal?
Sure. We'd have to look back to the exact date. I know that the VEST, the Virginia Emergency Support Team, ordered 350 ventilators from the national stockpile, as well as attempted to place an order for 350 in the private sector, and that has not been able to be filled. I also will say that our health systems are also reaching out to all of their supply chains, and hundreds of new ventilators are now available in the Commonwealth. So we are all trying to increase the numbers of all the protective equipment, and including support equipment like ventilators. So I hope that answers your question.
Kate, just to follow up on that too, we are also looking at innovative ways to better use the ventilators that we have. For example, using valves to take care of more than one patient at a time. So a lot of that is in the process, and we are doing everything that we can to, again, when we know that we'll, or at least expect to have the surge, that we'll not only have the bed capacity, but also the equipment to include ventilators and also the staffing that we need. So all 3 of these areas are being worked at one time.
Progress Index.
Thank you, Marissa. Governor, the police chief of the city of Petersburg took to Twitter this week to express concern about the essential classification of ABC stores being open. He posted on Twitter and a question directed to you. Quote, "If you want people to stay home, remove adult beverages from state shelves," unquote. Now, it's possible he could be having some local emotional reaction to that because of what happened last weekend on 95, double fatality, where a wrong-way driver from Petersburg is facing DUI charges. But have you heard from enforcement agents around the state on this, and how would you respond to the Chief Miller's concerns that he's saying? And also, could you also answer the public interpretation that part of the reason for the store staying open is that to help lower the traffic at emergency rooms due to substance abuse patients suffering from DTs?
Could you ask him to repeat the second part of his question?
Bill, can you repeat the second part of your question, please?
Sure. Can you also answer the public interpretation around that the part of the reason for the stores staying open was to help lower the traffic at emergency rooms around Virginia because of the possibility of substance abuse patients suffering from DTs and having to get emergency care?
Yes, the second part of your question, are we maintaining ABC stores so people can have access to alcohol to prevent the symptoms of withdrawal? And absolutely not. And I would encourage anybody or any family that is having issues with substance abuse to talk to their physician, talk to their counselors, etc. As far as the ABC stores remaining open, and we're treating them like any other retail. If they can maintain their business with maintaining the 10 or less individuals in a confined space to promote the social distancing, then we are allowing them to stay open.
Hi, yesterday you mentioned that an ExxonMobil site near Inova Fairfax would be selected as overflow in Northern Virginia. Can you talk about that site, and are we stepping back from that as an option?
The question is about the ExxonMobil site in Northern Virginia up in Fairfax. Yes, we are stepping back from that. We're using the Dulles Expo Center. As far as preparing those two buildings, we thought that the Dulles Expo could be prepared in a much more reasonable time, and so that's why we made the decision to use that rather than the ExxonMobil.
Greg Hambrick with Inside Nova.
Governor, staying on that topic, how confident are you that these alternative care sites will meet the needs of the surge? And are you preparing any secondary sites in case you need additional resources?
Sure. The question had to do with, as the governor designates these three first sites, one in Northern Virginia, one in the Richmond area, and one in Tidewater, how confident are we that that's going to take care of all of the needs of the surge? And second was the question, what other sites might be investigated? So first, we are, the first line of defense is in the state's plan is really the health system's own plan to surge their capability using their four walls and adjacent properties to maximize their effectiveness of their own staffs and beefing up those staffs as they are able, as a number of systems are, bringing in staff from surgery centers and other places that are no longer performing surgery. So that is the first line. And the second is a pop-off valve. The design of our surge plan is that to make sure that we can have a place that when a health system is taking care of a patient, they are almost ready for discharge or towards the end of discharge, we can get them out of that facility as they take care of the sickest patients. So to have large numbers of spaces strategically placed throughout the Commonwealth is critically important. When you look at those curves, there's a lot of variety between the numbers of beds that are surging and also the number of beds that the governor mentioned. So we're reevaluating each day what our needs are, but those are the sites that we are most confident of and the sites we're moving forward with today. The Corps of Engineers continues to look around the Commonwealth, now looking a little westward and southwestward as they may come under stress to look to see what the needs are and how we might best fulfill them.
Thank you, Dan.
Yeah, so we've obviously been talking a lot about housing for the homeless today. I know our newsroom has heard from at least one healthcare worker who, is obviously going on the front lines, interacting with patients that have COVID-19, and then having to go home to their family and have that concern. I believe some states have started to set up these healthcare workers in hotels and other accommodations like that. Any discussion about a similar protocol in Virginia?
I don't think we have anything specifically, but the question is, what about our healthcare providers that are exposing themselves to the possibility of contracting coronavirus when they're at the hospitals and nursing homes? And, I think it's a great question, and we haven't set up anything specific, but I think there would be the option, certainly working with our hotels, other folks around Virginia, that we could certainly find them a place and help them find a place, certainly, if they have that concern. It's, having been in that world, being at the hospital every day, coming home to your family is a real concern. And just personally, I would always use good hygiene, wash my hands, change my clothes, do those types of things, kind of common sense things. But if there are individuals that have that concern, we would be glad to work with them.
Julie Carey with NBC4.
You've been listening to Virginia Governor Ralph Northam with an update.
Hi. As you may know, the District of Columbia today released its modeling data And, it shows a somewhat dire picture ahead. If you are trying to drive home the importance of compliance, why hasn't Virginia done the same and let folks know a little bit more about what our modeling data shows?
It's a great question, Julie, and thanks for asking. The question is about our modeling, and there are obviously different models. We look at all of those, as I've said to Virginians every day. I'm all about data. It is not a perfect science by any means, but we are analyzing data that is coming from other countries that have experienced this, looking at their curves, other states, cities such as New York. Again, it's not a perfect science, but our best estimate is that the surge will be in the month of May. We're not sure whether it's early May, middle, or late May. If people want access to these curves, I don't think that those are classified. I think they're available on different websites, and I think people are more than able to do that. As far as what we're thinking, what the science we're using, the data we're using, we're giving that information to you every day. And as I've just said, our best estimate right now is that the surge in Virginia, and again, every area geographically in the world is different. But our estimate is that, and what we're preparing for, is that our surge will be in the month of May.
One more, so just to build on that, you're talking about timing, but in terms of, say, the share of residents, Virginians who might get it, I think what caught people's attention in D.C., as Mayor Bowser said, maybe 1 in 7 people could be expected to get it. I don't know if you've done that type of projection and if you'd be willing to share it.
Yeah, I don't have a 1 in 7, Laura. I think the question is, how many individuals will get it. The point that I would make to Virginians is if you don't abide by our guidelines, if you don't stay at home, if you don't practice social distancing, if you don't wash your hands frequently, and you're in the vicinity of someone that has coronavirus, you're going to get it, period. This is one of I was talking to some folks earlier today. I've been in this business for over 30 years. I don't know that I've ever seen a pathogen, whether it be bacteria, virus, whatever, that is contagious as this is. And again, I would just assume that if you're around other people, that there's a good likelihood that someone is going to have the virus, and you just need to follow our guidelines. We were pleading with Virginians to do that, and if we abide by those, we know that those work, and that will cut down on the risk of being infected, and it will also flatten that curve so that our hospitals aren't overwhelmed when the surge does occur.
Governor, of the models that are out there, are there any that you would point Virginians to if they want to get a better sense of that curve that you're talking about?
Does anybody want to talk about the different? Sure. Thanks.
Thank you. There are models that come out of the University of Pennsylvania called the CHIME model that really models hospital bed utilization. It does have some outcomes in terms of numbers of people, and you can get their projections around Virginia. The University of Washington has another model that paints a rosier picture, and you can look at that. Probably a month and a half or so ago, the Imperial College of London produced a model for the U.S. that you could also look at. The University of Virginia Data Science Institute has a research team that did work for the Defense Threat Reduction Agency and produced a model for them. The Virginia Hospital and Healthcare Association and the Virginia Department of Health have provided them with Virginia-specific data, and they are hard at work producing a model that will use that Virginia-specific data to generate a model that will more than likely be a better estimate. Remember, however, that models are models. The map is not the same as the territory. We've all used our GPS and been told to take a right turn when there was not a possibility of doing that. So take that into account when looking at these models, that they're not a prediction, absolute factual prediction of what will actually happen. It's a best guess using all kinds of assumptions and so on. You need to understand what those assumptions are. So take it with a grain of salt.
Again, I thank you all for being part of the discussion today. I hope that all Virginians can continue to abide by our guidelines, and also hope that all Virginians have a safe and peaceful weekend, and we will look forward to talking to you again on Monday. Thank you all so much.